This instructional video will assist with the administration of your flow-controlled infusion. Always remember to keep your PICC line dry and intact, and if it starts coming loose, let your home health nurse know so they can change the dressing. To start, make sure you have a clean work area and clean your hands thoroughly with antibacterial soap and warm water, and then dry your hands with a clean towel. The next step is to gather your supplies and medication and prepare for the infusion. Make sure you have the following supplies ready: your brochure picture guide, medication bag, IV tubing with flow rate controller, IV pole, flush syringes of saline and heparin, the orange swab cap, alcohol wipes, and a trash container. Then you will inspect the medication bag. Make sure you check that the label lists the correct information. The medication bag should be free of leaks or discoloration. Call the pharmacy if there are any problems with the medication bag or incorrect label information. The next step is to prepare your medication. Do not complete this step until you are ready to infuse. Fold the medication bag towards the vial and squeeze until the seal to the medication is broken. You will hear a small pop. Squeeze the bag to force fluid into the vial. Then gently shake the vial until the medication is dissolved. Hold the medication bag upside down and release squeeze to drain the mixed drug from the vial back into the bag. You may repeat these steps until the vial is completely empty. Do not remove the drug vial from the medication bag. The next step is to prime your IV tubing. Remove the IV tubing from its package. Close the clamp on the tubing. Place the medication bag on a clean, flat surface. Remove the tab from the medication bag. Remove the cover from the spike of the tubing. Do not touch the end of the tubing. Spike the bag by pushing and twisting the end of the tubing into the bag. Make sure the spike reaches the medication in the bag and be careful not to puncture the bag. Hang the IV medication bag on the IV pole. Gently squeeze the drip chamber to fill it about half full of liquid. Do not overfill. Turn the IV tubing dial to open. Open the clamp to prime the tubing, filling the tubing with medication. When the medication reaches the end of the tubing and there are no large air bubbles left in the tubing, close the clamp. Adjust the tubing dial to set the correct rate for your IV infusion. Your rate will be listed on the medication label. The next step is to prepare your flush syringes. Prior to using your syringe, push firmly on the thumb press with the tip cap still on just until you feel the plunger move. Then expel air and a few drops of excess solution by twisting off the tip cap and pushing the plunger forward. Then replace the syringe cap and be careful not to touch the tip of the syringe with your hand. If you do touch it, you will need to start over with a clean syringe. Repeat these steps for all flush syringes. After you complete the preparation, it is time to infuse your medication. This procedure can be easily remembered using the acronym SASH. Flush your IV with saline, administer medication, flush with saline, flush with heparin. First, flush your IV catheter with saline. Remove the orange swab cap from the end of your PICC line. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry for an additional 15 seconds and refrain from blowing on it. Then you will want to remove the protective cap from the saline flush syringe. Attach the saline flush syringe to the needleless connector on your IV catheter using a push and clockwise twisting motion until it is secured together. Then open the clamp on your IV catheter and/or extension if one is present. Flush your IV catheter using a push-pause method. Then remove and discard the saline flush syringe while holding the very end of your IV catheter. Dispose of the saline flush in a trash container. If resistance is met when trying to flush, verify your clamp is open. If resistance is still met, call your home health nurse. The next step is to administer your medication. Start by scrubbing the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds, and then allow it to air dry for 15 seconds. Then remove the protective cap from the medication tubing. Then you will attach the medication tubing firmly to the needleless connector on your IV catheter using a push and clockwise twisting motion until secured together. Ensure your flow controller is set to the correct rate. Then open the clamp on the medication tubing to start your infusion. Once the prescribed dose has infused and the medication bag is empty, close the clamp on the medication tubing and disconnect tubing from your IV catheter. The following steps are flushing your IV catheter with saline and heparin. Start by scrubbing the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Then you will want to remove the protective cap from the saline flush syringe. Attach the saline flush syringe to the needleless connector on your IV catheter using a push and clockwise twisting motion until it's secured together. Then open the clamp on your IV catheter and/or extension if indicated. Then flush your IV catheter using a push-pause method. Then remove and discard the saline flush syringe in a trash container. Repeat the same process with heparin. Attach protective swab cap and clamp line if indicated. Finally, call Landmark Infusion at 866-388-3883 if you have any questions or problems, or if there is redness, swelling, or tenderness at your IV site. Remember, our pharmacists are here for you 24/7.